Hello everyone, and thank you for joining our webinar today. My name is Todd Price, Senior Business Manager for QuantifiCare North America. QuantifiCare has over 20 years of international experience in 2D and 3D photography systems. This is the culmination of 2 decades of research work in stereoscopic technology, resulting in an easy-to-use all-in-one system. Today we're absolutely delighted to have Dr. Greg Chernoff as our guest speaker. He is a triple board certified facial, plastic, and reconstructive surgeon, an active contributor to the scientific community, founder of Chernoff Cosmetic Surgery, and an avid user of the 3D Life is Mini in his daily practice as well as his clinical research. Today, Dr. Chernoff will talk about effectively harnessing the 3D Life is technology to improve patient care and treatment outcomes. Standardization, accuracy, and reliability are all fundamental for effective image analysis and documentation. For any questions you may have, please leave them in the Q&A box for the end of the webinar. Thanks again for joining us.
Thank you, Todd, for the introduction, and thank you for putting on this webinar today. My name is Dr. Greg Chernoff. I'm an aesthetic, plastic, and reconstructive surgeon with practices in Santa Rosa, California, and Indianapolis, Indiana. We have a very busy aesthetic clinical practice, but we're also very involved in clinical research. And the LifeViz software application from QuantifiCare has been a tremendous addition to the armamentarium for providing science and education not only to our patients, but to our scientific publications. So we'll spend the next 15 to 25 minutes going over this technology, and then I'm happy to field questions at the end of the presentation. The QuantifiCare system from LifeViz has played a tremendous role in improving both the education and the quality of care that I'm able to provide to my patients. Today we'll talk about the concept of aesthetics as it applies today in most practices. We'll go over from a scientific standpoint the benefits that the LifeViz has provided to my patients, and we'll review some case studies with this. Those of us that provide aesthetics in our practices 100% of the time are seeing now a concept that we refer to as generational aesthetics. I see patients as young as 12 coming in for acne problems. Their skincare needs are very different from the Generation Z patients who come in. And their skincare needs are very different than from the premenopausal, postmenopausal patients. And in fact, with healthcare being what it is now, I'm seeing many patients ranging from 70 to 100 coming in saying, I don't feel my chronological age, so I don't really want to look it. So if you have a safe way of helping me, I'm really interested. And with a bicoastal practice, I have a large range of patients, not only Caucasian, but Asian, Mediterranean, Hispanic, Indian, as well as African American. And so the ability of showing the quality of their skin, showing the changes in pigmentation, the improvement in tone, quality, and clarity of skin plays a very important role in the education and in showing patients the value that they're receiving. Some of the most common non-surgical issues that we see coming into our office aesthetically, certainly the loss of elasticity, the increase in pore size, unwanted stria on the body are the best examples of fine changes in skin that we see. Post-inflammatory hyperpigmentation, very common in the non-Caucasian population. We see that the number one side effect of hormonal changes in women is pigment variation in skin. And many of those changes that we provide for patients then are subtle over time. And so in the past, we would look at a 2-dimensional color photograph of patients before and after, and perhaps talk ourselves into the fact that the patient might look a little better. The LifeViz system now helps us to quantify the changes for patients treatment by treatment, and it really allows us to show patients that they are receiving the value for which they are paying. From a dermatological standpoint, unwanted acne and acne scars remain very high in those features that have a negative effect on self-esteem. I do as many female hair transplants as I do male, so alopecia again plays a large role for patients seeking help. Many patients with changes that highlight vascularity, such as rosacea, also see a subtle change over time. So the LifeViz system helps us to, again, quantify these treatments. As I mentioned, many of these results that we provide patients with through non-surgical treatments are subtle over time. And so the ability now to quantify the results for patients treatment by treatment really helps not only in the education, but helping patients to see the value that they are receiving. 25% of our practice has remained dedicated to research and the publication of the clinical findings. In the past, we used to have to obtain biopsies to see histological results of neocollagenesis and neoelastogenesis in our patients. This, as I mentioned, required a biopsy. There was a time lag in seeing this. And so we know that the histological results precede clinical results many times for patients, particularly in some of the slower or non-visible treatments that we give. Some of the treatments such as ablative skin resurfacing or fractionated skin resurfacing, those patients can see their results in a two-dimensional photograph much quicker than can non-ablative treatments. The new drug Quo for treating cellulite, again, provides subtle results over time. Acne scar improvement, again, subtle results over time. The new field of biostimulator injectables, definitely subtle results over time, as are the improvement of stria. So this area of non-visible or slower to endpoint results are definitely the area where the LifeViz has played a large role in helping to educate our patients. This system, again, it's very compact. It's easy to use. Every time a patient comes into our office for a consultation, the first thing that we do is take the three-dimensional photograph with the QuantifiCare system. This allows us to give the patient a baseline skin report, measuring again the number of wrinkles, the number of pores, the overall evenness of their skin. It allows us to look at their pigmentation, to look at their vascularity. So it also gives a very high inclination of science to our patient base, and it increases their confidence in us really from the moment that we meet our patient. From a scientific standpoint, it really adds a new dimension in data collection for us, and a new metric, in fact, for data collection. We now are able to objectify what otherwise were subjective results through standard two-dimensional photography, and by standardizing the views and giving a three-dimensional component to it, it really allows us again to provide for scientific studies a new bar, if you will, for peer review. This is also, as we found in our recently published SaltFacial paper in the Journal of Clinical and Cosmetic Dermatology, the validation of results which have allowed for peer review acceptance of, again, what otherwise would have been very subjective results. This was one of the first papers that we utilized the LifeViz system in. The utilization of a topical nitric oxide generating serum helped improve the tone, quality, clarity of skin. It helped improve vascularity, and the LifeViz system was critical in the acceptance of this paper for publication. We then looked at the nitric oxide generating serum in our acne and acne scarred patients, which again, the results were subtle over time, and this allowed for the acceptance. The most recent paper that we have had accepted for publication was looking at the SaltFacial, which is a combination single platform utilizing sea salt exfoliation, a 3 megahertz ultrasound for driving protein peptides into the dermis, and then low-level light therapy. We compared this with microdermabrasion alone, as well as hydrating facial treatments. And these results are extremely subtle over time. And the chief metric in this paper was the LifeViz system from QuantifiCare, and this was solely responsible for the acceptance in the validation of our data that allowed this paper to be accepted. So here's an example again, comparing two-dimensional photographs with the three-dimensional views. And so again, it just allows, and patients are really in awe when they see this. You see their eyes open wide, and it really gives us a tremendous new metric for educating patients first off, and showing them their results over time. So several clinical benefits that we find this. As I had mentioned in our initial consultation, it provides a higher level of quality and the perception of quality from our patients when we are speaking to them about their skincare, particularly then in volumetric analysis for those patients seeking fillers. And the most common combination that I do in a single session that we'll show you upcoming is injecting Voluma into the malar, submalar regions, Juvederm into the nasolabial folds, and Volbella into the lips. Our nicest complement in these patients is when no one knows that they've had it done. And but the ability then of showing them the qualitative improvement through the LifeViz system really helps to improve the patient's impression of the quality that they received, and it definitely then validates our treatment results. So here's a tremendous example of a patient who had only one SaltFacial treatment. The results two-dimensionally are very subtle, but then when we can show him three-dimensionally and show him the metrics of the wrinkles and the depth visualization here in the forehead, you can see that the before on the left compared to the right to the after, again, we see an improvement in the depth of those fine lines in simply one treatment. And that's simply something that you could not see two-dimensionally. So this is tremendous new software that gives us validation on a daily, minute-by-minute basis in my practice that has been a tremendous addition for us in helping our patients understand the quality that we are getting. So we can show them side by side, we can do a rotational examination of the patients and show them then the depth visualization. Many times patients, if you look on my list on a daily basis, you'll see in my clinic's reason for visit, Mrs. Jones, unhappy, she's not sure she's getting what she's paying for. We then can show them, we take then a LifeViz photograph of them that day, we compare it then to their pre-treatment photographs, and we can show them that in fact, clinically, they are seeing improvement in wrinkles, in pores, in pigmentation, in vascularity, overall evenness of their skin, and the oiliness of their skin. So it can help us to reverse a somewhat unrealistic and unhappy patient. It also helps us improve our upselling and cross-selling. Patients come in for qualitative improvement in skin. We can show them from a volumization standpoint, which is really the second main sign of aging. More women lose fat in their malar region and perioral region, and we can show them then the benefits of what I refer to as total volumization. So it then provides us with a high-tech image, which gives us a distinct marketing advantage. So let's look at then at a patient that was treated with the intracell microneedling system. Again, these results can be subtle over time. But from a three-dimensional standpoint, again, then we can pick out an area such as the malar area and show them a qualitative improvement, rotational improvement, left side versus right side. With more patients not wanting downtime, again, we're seeing a tremendous increase in our non-surgical procedures, and the LifeViz system helps us again then to showcase the subtle skin changes that we're seeing, and the added three-dimension evaluation again gives the higher scientific value for our patients in this regard. So again, the ability then of showing the patients first from a two-dimensional system, the measurement of their wrinkles, pores, general evenness of skin, oiliness, pigmentation, and vascularity. We then see a measurement, a graph basis from QuantifiCare's patient database, ranging from +10 to -10, where +10 represents the top 2.5th percentile of the best subjects in the database, where a -10 represents the bottom 2.5th percentile of the worst patient results in QuantifiCare. You can then see those graphs improve from treatment to treatment, and many times these graphs improve from treatment to treatment, where clinically in a two-dimensional photograph you don't pick that up. So again, it's been a tremendous addition for us in helping our patients see this. As in with this patient had a single SaltFacial treatment, and again the results are very subtle. However, when we look three-dimensionally and when we show the patient, then again you can see that in fact there has been a very nice improvement even with one treatment. So we take a patient who was really less than impressed looking at a two-dimensional photograph, and where we can show them then the improvement in fine lines. We can show them the volumization improvement when you look at the depth and the colors shown in the depth of, in this regard, in her nasolabial fold. Another example from an acne treatment utilizing our cryofacial, and again this can dramatically reduce inflammation, improve the overall complexion of patients by reducing redness. It also over time can stimulate collagen and improve skin structure. And so again, in the matching of this, you can see a before versus after. And again, by being able to rotate, being able to show the patient side to side and show the improvement in the redness. This is a beautiful feature of this, the wanding back and forth to show the improvement in the reds. You can then take the cursor box over a specific area of concern and show the patient individual areas from a before and an after. The slider, again, you can see patients' eyes open wide as you show them this. And again, the three-dimensional improved scientific component again really also improves a patient's confidence in what we're showing them. Here's a combination patient. Again, this patient was suicidal with his acne, and so again showing what otherwise may have been a somewhat subtle result at first. Again, we were able to show the patient from a three-dimensional standpoint by matching, by showing the overlap before and after, to really show a very dramatic improvement in both his active acne, in his early acne scars, and in fact in some of his more mature scars as well. And so again, you could just see the improvement in the self-esteem, the improvement in the confidence of this patient. And again, the system really allowed us to educate this patient. Some areas that were of specific concern in the perioral area, again, by showing the overlap before and after, again, was a tremendous tool for us to be able to first educate the patient, but improve his confidence then in the value of the treatment that he was receiving. So once again, whether it's quality improvement in skin, the volumization feature is also extremely impressive in patients. So the most common combination again that I utilize is Voluma in the malar, submalar region, Juvederm in the nasolabial folds, and Volbella into the lips. So yes, we see a nice two-dimensional improvement, but the addition then of utilizing the three-dimensional component to show the patient the before and the after really helps us to improve the quality of education for the patient. The volume assessment, again, adding tremendous science for patients to really show them the improvement that they're getting. because again, we don't want to make these patients look like blowfish. So you can see the beautiful volumization and the silhouette feature. This is what patients really improves their confidence. When you can show them where they were before, where they are after utilizing the silhouette feature. So this has been such an amazing improvement in our educational tools, and also then in the value added for our patients. So this software is extremely easy to use. I always joke with doctors that if Greg Chernoff can make it work, anyone can make it work. So it's easy to use. It allows us to objectify and validate our patient results, which really leads to a higher number of extremely happy patients in our practice. So I'd like to thank you for your attention. I'm happy to field questions. I'm available. This is my email. You can email me anytime. You're welcome to call me anytime. I'm happy to talk you through the value of this system and help you implement it into your own practices. Thank you again to QuantifiCare for providing the ability to educate patients on this amazing new technology that is helping me and my patients achieve the results that we're wanting to. Thank you for your attention, and I'm happy to field questions.
Thank you for the presentation, Dr. Chernoff. So thank you all for attending. We're going to go ahead and field a few questions that we received during our Q&A. So the first question looks like it's for you, Dr. Chernoff. How will this improve my workflow?
Without question, exponentially, because the moment currently in both of my practices, the moment a patient enters our office, instead of just sitting in the waiting room, our graphic artist comes and gets the patient in the waiting room, takes their QuantifiCare photograph, takes their photograph for computer imaging, prints out their analysis and hands it to the patient so that they can be seeing it while they're waiting. As I'm sure everyone on the webinar this evening, I hate to keep people waiting. And instead of having them just read magazines in our office or watch television, now they can study their own science before I see them in consultation. So it improves the flow because you're already educating the patient while they're waiting to see. And this has then been, once I enter the room, they're already very impressed with the science that we're offering them, because they tell us daily. We waited for a range of time in other offices. No one did this for us. So there's already an added measure of confidence, an added measure of respect, and added anticipation of what they'll receive from our. So from a patient flow standpoint, giving them education prior to you, the doctor, seeing them is a tremendous benefit.
So we'll go to the next question here. All right, maybe a question for myself. What is the learning curve? So I'll let you answer if you'd like, Dr. Chernoff.
If Greg can do it, anybody can do it. That's the best.
Okay, so that's actually perfect. So what I would say is, the learning curve is really like getting a new cell phone. It will appear, a little new, slightly foreign at first, but with a little bit of muscle memory, it is really, really quick and easy to use. We have a really, really wonderful and dedicated team to making sure that you and your staff are fully trained to be able to use the technology to the best of its capability.
Let me just add to that and compliment you on your customer service, because many times from an electronic standpoint, my staff refers to me as the mental midget. And so you were always tremendous at responding to us when we had questions in a timely manner so that our patient flow wasn't disrupted. So your service to the system is also unmeasured.
Excellent. Thank you very much. Pride ourselves on it. Let's go to one more here. Okay, this is definitely for you. So do you feel like you got your ROI on your system?
So I have been invoiced every retail dollar that anyone visualizing this webinar would be, and we tracked this at year end. And I can easily say that we received our ROI probably 100-fold easily in both of our practices, because it helps conversion rate, because patients from the moment they see you have a higher level of confidence. Always within our practices, we take the position of educating, not trying to sell. And the educational benefit compared to someone going somewhere for a consultation and being told, well, we have things you can use at home every day, things that you can use with our estheticians every day, things that you can do with me every day, and show them a two-dimensional photograph, again, trying to talk them into the fact that they might look a lot better, is far different from showing them your two-dimensional and three-dimensional results with your graphs from your patient database, which definitely objectifies what otherwise would have been subjective difference. So it's like I said, this has been probably one of the greatest additions to our practices, from a cross-selling and upselling everything that we do.
Great, thank you very much. Let's see, we got a little bit of time for maybe only a couple more questions. Okay, so the next one, I'll take the lead on this one. So this physician wants to know, what's the main difference between having a two-dimensional system versus a three-dimensional system? So the main things that we probably want to remember, specifically whenever we talk about medical aesthetics, having the ability to quantitatively measure volume is really, really key. Imagine a two-dimensional image. We've got an X and a Y axis. It's a flat image. So when we talk about changing volume, you need the X, Y, and Z axis to be able to achieve such. So the main difference here is the fact that with 3D, we have the ability to really objectively see all of the change that is occurring. Again, just like Dr. Chernoff has mentioned, these changes that can be incredibly subtle to see to the untrained eye. Difficult to see, as you're looking, or your patients are looking at themselves in the mirror, each day, seeing the same thing over and over and over again. It can be difficult to have an objective approach. Having a 3D system, again, it allows us, to be able to quantitatively measure those changes. But beyond that, it saves a lot of time, in particular with image capture. So rather than spending, tons of time trying to capture a perfect angle, with the use of 3D, again, the X, Y, and Z axis, we can then rotate and orient the image in any position imaginable, and the before and after images are going to be a true, apples to apples comparison. So again, when it comes to medical aesthetics, when it comes to measuring objective quantitative change, 3D is absolutely paramount.
I can just add, if I can just add to that. So anyone watching tonight who does injectable fillers, if you take pride in doing them in a meticulous way and not making your patients look like blowfish, then many of the results, again, should be subtle but noticeable to you and your patient. But our nicest compliment is when no one knows they've had it done. And the ability to three-dimensionally show them, particularly the silhouette feature, where you can beautifully show them the subtle curvature of their malar, submalar region, show them the decrease in depth of their nasolabial folds, show them the increased volumization of their lips, without anyone saying to them, who did that to you? That's a grand slam with that. For those of you that do facelift surgery, doing a head down and rotational view, showing them how their submental area is so improved. Again, this has improved our close rate. This has improved our satisfaction rate with these patient populations.
Excellent. All right, I think we are running toward the end. I will get one final question in here. Again, so this one may be one that I'll take. What other body parts can we capture other than face? So as you can see, we do have a full product line with the LifeVis systems. We have everything from skin microstructure to face to breast and body, and then our LifeVis Infinity, which will do face, breast, and body. We have the ability to do full circumferential imaging of the abdomen. We can quantitatively measure those large volumetric changes, specifically with energy-based device treatments or fully invasive device or invasive treatments. We really have a one-stop shop. So no matter what it is that you're looking for or what need that you have that you cannot receive with your two-dimensional camera, we absolutely have a product that will suit your needs. So let's see, is there anything else that you would like to add, Dr. Chernoff?
No, again, I've been at this almost 30 years, and as those of you that have done this for a long time, it's rare that things come. There's so much technology that we're exposed to, and it's very rare that technology comes along that only, without hesitation or reservation, say makes it a definitive difference in your practice. And I can definitely say this, with this system. So you can also see the excitement in your staff, because our staff that used to have to deal with unhappy patients because they thought they weren't getting a good result, and all our staff could show them was a two-dimensional photograph. Now they have science that they can take into the room to the patient. And there's nothing more gratifying than a patient who is unhappy, showing their before QuantifiCare, their after QuantifiCare, and we leave them in the room then for 10 minutes before I walk in. And 9 times out of 10, I'll walk into the room and the patient will say, I was coming in to rag on you today because I wasn't really thinking that I got a good result, but look, I really do look better. So it really is the 3D is really science that anyone that does aesthetic work, particularly non-surgical, will see tremendous benefit from.
Well, wonderful. Well, thank you so much again. I really want to thank you for dedicating your time for this wonderful presentation. If there were any questions that we could not get to, in the time that we had allotted, please feel free to email us at info@quantificare.com, and we'll get back to you as soon as we can. Thank you all for attending, and have a wonderful evening.
Good night.